Welcome to RB Medical Coding class. If you are an experienced medical coder preparing for an interview, you've come to the right place. In this video, I'll be sharing some of the most commonly asked interview questions along with expert answers to help you ace your next medical coding job interview. So, stay tuned, take notes, and let's get started with the first question. Question 1. Can you explain your experience with medical coding? Answer. I have been working as a medical coder for 2 to 3 years, specializing in specialty, AIG, inpatient, outpatient, radiology, surgery, etc. I have extensive experience with ICD-10-CM, CPT, HCPCS coding systems, and compliance regulations. In my current role at company, I handle coding for specific department, ensuring accurate claim submission, reducing denials, and improving revenue cycle efficiency. Question 2. How do you ensure coding accuracy and compliance with regulations? Answer. I follow strict quality control procedures, conduct self-audits, and stay updated with coding guidelines. I regularly review CMS, AMA, and payer-specific guidelines to ensure compliance. Additionally, I participate in coding workshops and webinars to keep up with any changes in regulations. Question 3. How do you handle coding denials and rejections? Answer. When I receive a denial, I first analyze the explanation of benefits, EOB, or remittance advice to understand the reason. Then, I verify the coding, documentation, and payer policies. If needed, I collaborate with physicians or billing teams to correct the error and resubmit the claim. For frequent denials, I work on process improvements and provider education to prevent future issues. Question 4. How do you code complex cases, such as surgeries or multiple procedures? Answer. I carefully review the physician's documentation and apply the correct primary and secondary procedure codes based on CPT guidelines. I ensure that modifiers are used correctly, such as 51 for multiple procedures or 59 for distinct procedural services, to prevent claim denials. I also cross-check with ICD-10 codes to support medical necessity. Question 5. What is the difference between CPT, ICD-10, and HCPCS codes? Answer. CPT codes, current procedural terminology, are used to describe medical procedures and services. ICD-10 codes, International Classification of Diseases, are used to report diagnosis. HCPCS, Healthcare Common Procedure Coding System, includes CPT codes, Level I, and supplies, equipment, and non-physician services codes, Level 2. Question 6. What coding software and EHR systems have you used? Answer. I have experience with list software like Epic, Cerner, Meditech, 3M Encoder, Optum 360, etc. I am proficient in using these systems for documentation review, coding, and claim submission. Question 7. How do you handle situations where documentation is unclear or insufficient? Answer. I follow up with the physician or healthcare provider to clarify the documentation through queries. I ensure all communication is compliant with documentation integrity and follow facility protocols for obtaining additional information. Question 8. What modifiers do you commonly use, and when do you apply them? Answer. Some commonly used modifiers include Modifier 25, Significant, Separately Identifiable EM Service, Modifier 59, Distinct Procedural Service, Modifier 50, Bilateral Procedure. Modifier 91, Repeat Clinical Diagnostic Lab Test. I use these modifiers based on documentation to avoid claim denials and ensure correct reimbursement. Question 9. How do you stay updated with coding changes and industry regulations? Answer. I stay updated by regularly attending AAPC, AHIMA webinars, subscribing to CMS updates, reviewing payer policies, and participating in continuing education programs. I also take refresher courses and network with other coding professionals. Question 10. Have you ever conducted coding audits? If so, how did you approach them? Answer. Yes, I have conducted internal coding audits to ensure compliance and accuracy. I use coding audit tools, review a sample of coded charts, and identify patterns of errors. After the audit, I provide feedback to providers and coding teams and implement corrective actions if needed. Hope these questions and answers help you feel more confident and prepared for your next interview. If you found this video helpful, don't forget to like this video, subscribe to RB Medical Coding class for more coding tips or career guidance. Turn on the notification bell so you never miss an update. If you have any questions or want me to cover a specific topic, drop a comment below. Thanks for watching, and I'll see you in the next video.